us this evening here at SeeBeyond Medicine. My name is Dr. Bernie Lee. I am an integrative pain specialist, and tonight we're going to be talking about chronic pain and various integrative and some high-tech approaches to how we can address and treat chronic pain. The name of tonight's lecture is Unmasking Pain, Journey to the Root of Chronic Discomfort. So again, my name's Dr. Bernie Lee. I have a couple of roles I am the Director of Medical Administration at MJHS Hospice of Care. As you can see, I'm a double board certified physician. I'm board certified in family medicine as well as palliative care. I am a U.S. Army veteran, graduated from West Point in 1988, served as a U.S. Army armor officer, led soldiers on tanks, not a physician in the Army. Didn't go to medical school until after I left the service. In addition to being a family medicine physician, as well as a hospice and palliative care physician, I'm certified as a medical cannabis specialist, as well as a medical activist. So let's talk about exploring pain. What is, well, let's start with a definition. Pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. When we talk about pain, there's a lot of different ways we can distinguish different types of pain. One way is separating it into the two categories of acute pain and chronic pain. So acute pain is pain that really lasts up to about 3 months in duration. And acute pain actually serves a protective purpose. So as an example, a young child reaches up to the stove to grab, and because the flame on the stove is very pretty, and before that kid touches the flame, they're going to feel the pain from the heat and they're going to draw back. So that pain is a protective pain. Or you sprain your ankle and the ankle swells up and it hurts. Part of the way that pain is protective pain, it keeps you ambulating on that ankle, allowing that ankle to heal over the next. Once again, that acute pain serves a protective function. Chronic pain, on the other hand, lasts longer than 3 months duration, and it serves no positive purpose whatsoever. In fact, chronic pain becomes chronic more often than not due to ongoing tissue damage or other chronic disease that the pain is associated. In addition to that, chronic pain often leads to different sequelae that can include depression, anxiety, insomnia. Those are 3 big ones, but the list doesn't stop there. Appetite changes where people certainly voluntarily and unwanted lose weight, or the exact opposite because of a sedentary lifestyle due to chronic pain. People gain. And just like the onset of chronic pain might have started with something acute, usually the development and progression of chronic pain is multifactorial. Likewise, treatment of chronic pain needs to be a multifactorial treatment. Rarely is there just one treatment option for chronic pain. Really not how it works. Lastly, acute pain, goal is usually to do away with acute pain, and that usually comes with taking care of the underlying cause of that acute pain. Chronic pain, however, if we can abolish chronic pain completely, that's a really added benefit. However, the goals of chronic pain treatment reduce that chronic pain to tolerable levels and improve quality of life. But the likelihood of completely abolishing chronic pain is not always a realistic goal. So that being said, what are some treatment options that we can go over, especially from an integrative approach? Okay, so as many of you may know, some of the old school chronic pain, certainly WHO, the World Health Organization, explanation of treatments, where if you had mild pain, you might be treated with something like Tylenol or acetaminophen or an NSAID like ibuprofen. But moderate pain, certainly get those treatments, but there might be a low dose opioid attached with that. And if you had severe pain, certainly opioid therapy was used to be the gold standard. As many of you well know, in recent many years, gone through an opioid epidemic in this country, and people are dying every day in this country. And that has certainly sprouted a long litany of uh, investigation in various integrative approaches. And many patients now will elect to go the integrative route for pain management as opposed to medical. So this list here is certainly not an exhaustive list of therapies. It's a short list of examples of things that are out there, and a short list of examples of some of the things that we offer here beyond medicine, but certainly not an exhaustive. We have acupuncture treatments as well as biopuncture. These are similar, but not the exact same thing. We're going to go through a summary of each one of these. Something called electric stimulation. One of the newer therapies that we've been doing here in the last year or two is called shockwave therapy. Many of you may have heard in the news the buzz about medical cannabis or medical marijuana in the country. Certainly been legal here in New York now for about the last 8 years, went legal in 2016. Along with medical cannabis, our CBD. But what's new and exciting that we've started doing here at SeeBeyond Medicine is several months, and really, it's really a new phenomenon throughout this country is intravenous or IV CBD. Another relatively new option that has quite successful for our is phone therapy. And then not an integrative therapy, certainly a medical therapy, but certainly considered more high-tech and progressive ketamine therapy, especially when it comes to getting patients off. And lastly, there's stem cell and exosome therapy that we're doing. So acupuncture, what is acupuncture? Acupuncture, it originates from traditional Chinese medicine, and it's been used literally for thousands of years. Far more people have gotten acupuncture over the course of time than have gotten regular conventional Western medicine. Acupuncture is performed by taking very thin needles and inserting them into specific points on the body. They're acupuncture maps of the human body, where a phenomenon called qi, known as a life energy force, flows through your body. When you are born, you're born with a certain amount of qi, and the day you die, you have no more qi left. It flows through all living things in this universe, like your body. And anytime you start to have disease, pain, symptoms, in the notion of Eastern medicine, that's a function of qi not flowing properly, where qi gets stagnant or disrupted in the flow through the body. So acupuncture points fall on the body in different meridians that the qi. By using acupuncture needles, we can free that up, allowing the qi to appropriate. And this restores the bodies into balance and stimulates natural healing mechanisms. Look at it from the Western world, we know that acupuncture releases endorphins, and other bodily hormones that really reduce pain and bring comfort. Likewise, there have been studies looking at PET scans of the brain. When acupuncture needles are placed in, certain parts of the brain light up. So it's still not 100% clear from the Western mind how acupuncture works. It's certainly clear in the Eastern mind, but the bottom line is it works, and patients certainly benefit from acupuncture. Anyone who were to not take medicine, acupuncture is clearly an option. Likewise, biopuncture are also also where you get injected with a needle. However, not just the needle, you're injected with some medicinals that are natural medicinal. The most common examples of natural medicinal, meal and zeal. Meal, basically a substance where we have botanical extracts as well as mineral extracts extracts come together, producing medication we call pill. Pill comes with great anti-inflammatory properties and pain relief. Other of the two substances that we use commonly is steel. Steel is a homeopathic remedy that, again, brings great anti-inflammatory support and is very good for pain. Biopuncture can certainly inject at any one of the acupuncture sites or what we call trigger points. Trigger points is a Western conventional medical therapy similar to biopuncture. You're injected with a needle, but what gets injected into you is a combination of lidocaine and steroids. Trigger points also do work. Anybody that cannot tolerate steroids or lidocaine, any number of medical reasons, biopuncture would be a much safer route, as well as acupuncture, the much safer route than the trigger point. That being said, can also work nicely. So with biopuncture, we also use it to help faster healing, to support acupuncture, but again, like we said, can also be used to completely replace trigger point injection. The next therapy that's commonly used, electric stimulation. Electric stimulation can come in several formats. Bottom line, whichever format you're using, it's electric currents that are used, that are sent to stimulate your muscles. Those electric currents modulate the nerve activity to pain. Doing so, we're blocking the pain signals. And much like acupuncture does, electric stimulation so stimulates endorphins that further help decrease pain, decrease inflammation. Electric can muscle spasm, swelling, can be used range of motion, and likewise, like the other aforementioned therapies, also help to promote. The next one on the list, shockwave. So with electric stimulation, those electric impulses are being delivered. And by the way, at SeeBeyond Medicine, with electric therapy, electric stimulation, we use a machine pulse can. So the difference between shockwave therapy and electric stimulation therapy, that with shockwave therapy, what your body is being hit with, high energy acoustic, otherwise known as sound waves. So very similar to how when a pregnant woman gets an ultrasound, where sound waves to visualize the fetus inside the mother's uterus. Similar sound waves are being shot out at the patient. However, it's very high energy sound waves. And these high energy sound waves become clear over years of research that these sound waves decrease inflammation, stimulate new blood flow. In stimulating blood flow, your cellular repair mechanisms get stimulated, and tissue regeneration is promoted. In these steps, pain gets relieved, range of motion is increased, bodily functions become improved, and your quality of life then gets improved. Shockwave. Next thing on the list that we talked about was medical cannabis, otherwise known as medical marijuana. So as of today, in May of 2024, medical cannabis is now legal in 38 states throughout the country. In addition to that, Washington, D.C. and 3 of the territories, which include Puerto Rico, Guam, and the U.S. Virgin Islands. Medical cannabis, very clear is that it provides wonderful anti-inflammation, has great anti-spasmodic properties to help relieve muscle spasm, and it can also be administered in a few different ways. So when most people, when they think about marijuana or pot or weed or ganja, whatever name that you want to give it, we think about smoking. So you can certainly inhale cannabis medically. My recommendation would be to vape it and to not smoke it. And we can go into that in much more detail. But there are, in addition to inhaling cannabis, as a medicine, it can be taken orally, and it can also be used topically. Reasons that you might want to inhale it, it's the fastest onset of action. Inhale cannabis, start to feel the medical effects within minutes. You're at peak effect at 15 minutes. I'd like to take a moment to compare that to in a hospital, fastest way to get somebody out of pain by injecting them with an IV push of an opioid, IV push of morphine. If I saw any one of you as a patient in the emergency department or in a hospital, and we gave you an IV push of morphine to get you out of pain, you start to feel the effects in a few minutes. You get the effect of that IV morphine push in 15 minutes. That's the exact same rate of speed as inhaled cannabis. So by inhaling cannabis, you can get yourself out of pain just as fast as an IV push of an opioid. Now, other routes be an oral route. The reason to take an oral route would be needed longer lasting pain relief. So the inhaled route comes on quickly, but it also leaves your body, clears in your body in about 2 hours. Using cannabis for something like a panic attack, for example, you might not want that cannabis floating around your system all day long. However, if it's something like a panic attack, by inhaling from a vape pen, you can squash that panic attack right away, and that cannabis that you inhaled won't be in your system 2 hours later. Whereas, as an example, if you took something like an oral pill of Xanax for a panic attack, many a time that panic attack is actually over before the Xanax actually kicks in because you have to metabolize it. This particular case, by inhaling cannabis, you squash it and it doesn't stick around in your system. Take cannabis orally. It does take a while, just like any oral pill, to kick in because you have to metabolize cannabis. Start to feel the effects at about 45 minutes to an hour, and you're at peak effect at the 2 hour mark. And that is on par with any oral pill that you have to swallow. The benefits of oral versus inhaled is that the effects last much longer. They can last upwards from 8 to 12 hours. People who take cannabis or cannabis medically in the oral form, they might take 2 or 3 doses a day, and that usually lasts folks all day. Lastly, to complement both the inhaled and the oral route, we use topical cannabis. Any localized pain, joint pain, spasm works quite well. So on the right-hand side of the screen, there's some various types of pain that cannabis, with great evidence, quite well. Neuropathic pain is one of them. Visceral pain, meaning pain from your internal organs, are another one. That can be GI related. It can be GYN related, for example. Cancer pain is some of the most difficult pain to treat, as well as bone pain. Cannabis works very well there. In addition to that, any of the sequela that we experience from chronic pain, like nausea and vomiting, like insomnia, depression and anxiety, appetite problems, cannabis can help address all of those as well. So not just the pain, but many of the sequela symptoms follow on with chronic. Medical cannabis is also one of the primary tools that we use in medicine to get patients off of chronic opioid therapy. So patients who are opioid dependent for many years, and many of those patients, and some of you out there might be some of those patients, after many years on an opioid, most people will tell you that the opioid doesn't even help them feel comfortable anymore. It what they need to get the edge off the pain, just to get out the door, so function, but their lives and quality of lives are no longer really maintained, even though years ago when they first started the opioid, great to stop pain. Nowadays, we spend far more time getting people off of opioids than starting them. Cannabis is certainly one of the keys. Really, every therapy we're talking about today has some role in that. Cannabis is one of the mainstays. Along with medical cannabis, I talked about, mentioned, right? What comes hand in hand with that is legal over-the-counter CBD, a lot of legal over-the-counter CBD. But more importantly is this newer therapy, very high-tech and modern, called IV CBD. IV CBD does everything that oral CBD does in much more intense. So when you take CBD, only a certain amount of it that's available that there's only a certain percentage of that CBD that has bioavailability. The IV form, almost all of that CBD bioavailable. So with IV CBD, we see very potent anti-inflammatory CBD both orally, but certainly IV is used as an anti-epileptic, meaning it's seizures. CBD has anti-cancerous properties, often used to help in the fight for cancer. I wouldn't say at this stage of the game that CBD or cannabis is a cure for cancer, although if you look online, there are plenty of anecdotes that have recovered from their cancers with cannabis and CBD. Do know fact is in the research, CBD causes a phenomenon called cell apoptosis in cancer cells. That's where all cells have a cell wall around it, and CBD attacks that cancer cells, breaking it apart. That's the cell apoptosis. Once that cell wall breaks, the contents of the cells out, and that cell is now a dead cell. That's one of the ways that modern day chemotherapy works. But as many of you may know, chemotherapy doesn't necessarily do a good job distinguishing between cancerous cells and healthy human tissue, which is why chemotherapy oftentimes is not tolerated, causes many problems and patients to get sick ways. CBD, however, does distinguish, and it causes cell apoptosis in cancer cells, being actually very healthy, positive for healthy tissue. CBD is also highly neuroprotective, and along with addressing pain, inflammation, being neuroprotective, and helping with spasticity, it also addresses the stigma of chronic pain by addressing anxiety, depression, and PTSD. We have quite a handful of patients SeeBeyond for treatment PTSD, cannabis, and good success. Next is one of the newer therapies that we do here called ozone, which is quite exciting. So ozone therapy hyperoxygenates the blood, and it improves oxygen delivery to basically every cell in your body, all of the tissues, all of the organs. And in doing so, by hyperoxygenating your blood and delivering high content oxygen, gets enhanced as your blood circulation, your immune responses get modulated, and modulating immune responses, inflammation is lowered. Sorry about that. I will put that on vibrate. My bad. Inflammation is now decreased through that immune response modulation. There then becomes promotion healing and tissue regeneration. As you can see in the picture, there's a bag of blood hanging there. So we basically insert an IV catheter where we take blood out of you. That blood passes through two machines. First is a UV light machine where your blood gets sterilized, and it's a part of the immune response. In addition to that, it now goes through a second machine where a tank of ozone on O3 mixes with your blood. The blood that's getting mixed, that's out of your arm, it's a dark red colored blood because that's your venous blood when oxygen has been already used by your body. As it's mixing with the ozone, that dark red blood starts to turn a bright red pink as it's becoming hyperoxygenated. For a science geek like me, it's a very cool process to watch. That hyperoxygenated blood is now pumped right back into you, so you're on a closed system. And the vast majority of patients, as that blood is being pumped back into them, they feel themselves waking up and they feel symptomatic relief in real time as the blood is being pumped back into you. But we've used ozone now with great success. And let's move on to the next therapy. So the next therapy, as we said, ketamine therapy is certainly not an integrative therapy. It is a hardcore school medicinal. Its original use has been as an anesthetic, used in the OR to put people under so that folks can be asleep while they get their surgeries and not feel anything, and they're certainly out of it after their surgery is over. Now, outside of the OR and outside of the hospitals, ketamine has grown more popularity for chronic neuropathic pain. It's been now for treatment-resistant depression. Here at SeeBeyond Medicine, we use ketamine therapy for both pain as well as depression. Ketamine acts on NMDA receptors in the brain. So NMDA is N-methyl D-aspartate. The bottom line is by binding to NMDA receptors in your brain, what gets modulated are not only the way that we interpret mood and mental health. So it calms anxiety and calm depression nicely, but also acting through the NMDA receptors, ketamine calms pain. More recently, what's shown out there in the evidence out there, but what we have experienced right here at SeeBeyond Medicine is ketamine therapy for opioid cessation for opioid dependent. Certainly going to share some cases that highlight therapy. Next and almost last, we have stem cell. Stem cell, for many years in the past, is very controversial. It's no longer controversial, and that what's now very clear are the medical benefits. So stem cell therapy, stem cells address your regenerative potential in your body. Stem cells that you receive through an injection differentiate into specialized types of cells depending on what your body's needs. So as an example, if you have severe degenerative joint disease or arthritis in your knee, and you may be headed for knee replacement and have to, we have had patients here at SeeBeyond that will get stem cell therapy, stem cell injection into their knee, and quite a few patients have had avoided surgery. Doing so, stem cells recognize that knee is major thing, and what gets stimulated is that those stem cells now develop into cells that are needed in your knee to help rebuild your knee, as an example. Stem cells, they modulate an immune response, inflammation. In doing so, stem cell therapy improves their function. People who have gotten stem cell therapy are incredibly happy. So stem cell therapy is not only used locally, as the example I gave with the knee, but can also be systemically for larger diseases that are causing your pain. And it's the disease that we address. There are many examples of that. We're going to go over one case that of medicine. Lastly, but very related to stem cell therapy, is exosomes. So exosomes are small particles that are derived from stem cells. Small particles contain growth factors with the genetic materials to stimulate your healing. So exosomes really the next generation advanced treatments that came after. Like stem cell therapy, exosomes modulate your immune response to reduce inflammation. They harness your body's natural healing mechanisms. So the impact of integrative care, we're now going to go over a couple of case study number one is a woman with rheumatoid arthritis. We have a 58-year-old female with chronic pain secondary to long-standing rheumatoid arthritis. Patient for better part of 15 years on a biologic. He was one of the original test patients when this biologic was undergoing its clinical trials. So she got on in one of those original trials and it stayed on this medication for better part of 15 years. During her earlier stages, she quite well. However, fast forward to about 13, 14 years later, and certainly into her 15th year, her disease progressively started to get worse. Certainly had more frequent exacerbations of her rheumatoid arthritis pain with an overall worsening of her baseline. What came with that was major fatigue. She was I'm sorry, she was a very successful businesswoman, and the pain and fatigue really hindered her professional life, but starting to also take a significant hurt. And in addition to that, she was starting to get that early feeling that you can get with rheumatoid. So this particular patient was very interested in stem cell therapy. However, being on the biologic agent, she didn't have stem cell. Through the washout period off of that biologic agent. So in order to get her off of stem cell therapy, idea was that we were going to start medical cannabis, medical marijuana. And in my initial intake with her, one of the questions I ask everybody that's about to start cannabis, their what their history and their use of cannabis has been. And as you can imagine, we have a wide variety out there. Some people started cannabis use as a teenager and never stopped. Others has were once touched it in their entire lives. This particular woman had never touched cannabis and had a lot of concerns and fear, a lot of education, but also understanding how concerned she was. We didn't start with actual medical cannabis. We started with legal over-the-counter CBD. And this was quite a few years ago before IV CBD was available. We started her on oral tinctures, which she tolerated nicely. And we gradually titrated her dose over time. Found that the CBD was very positive for her general well-being. It helped to improve her mood, helped to improve the quality of sleep. It was starting to touch her pain a little. And that's when we then transitioned her over to actual medical cannabis that has THC in it as well. And we had to go very low on the THC and much higher on the CBD for them becoming cognitively impaired. She didn't want to be stoned. Again, a very active businesswoman with an active lifestyle. Didn't want that to get in the way. So we started with, again, very low THC with much higher CBD, prevented her from getting stoned. Tolerated that nicely. For time, we gradually, slowly but surely, THC was getting, never going to high amounts of THC, but just a gradual amount to balance out CBD and THC where she was getting equal amounts. Got to a point where her pain was very well controlled on her medical marijuana. And at that point, when she had gone through her washout period, and able to get her stem cell therapy, she responded quite well to stem cell therapy. Today, patient is on no medication treatments. This and is actually doing quite well. So that is certainly a huge success story, and a story that highlights at least three different therapies here, the multimodality approach to pain conditions that had long-standing pain for many, many years. The next case, study number 2. This is not a multimodality story. This is an example of the potency of IV ketamine. So this particular case, we had a 36-year-old young woman who had chronic pain, what we call cervical, otherwise known as chronic neck pain. And this was due to degenerative joint disease in her spine. This actually started as a child. She had a major traumatic injury, which started her down spiraling life of chronic pain. Again, which started as an adult. She not only has severe chronic pain from the spine, but what came along with that was muscle spasm and severe neuropathy. And then, of course, as we commonly see, what developed over time then was a cycle of depression, anxiety, as well as patient. By the time I met this patient, she had been open a few years. Not only was she opioid dependent, so many of you are probably aware of the dangers of opioid from this opioid epidemic, dying left and right. But it's not just loss, faith, and death. Opioids themselves are very unhealthy. They have their role, great to address a severe pain. However, they're not the appropriate treatment for chronic pain for anybody who's going to be in pain and treated for a long time. Opioids cause destruction in many other parts. This particular woman had severe what we call renal insufficiency. Renal glands are what give you that fight or flight reaction. They're part of energy to get up and go oomph for whatever you have to get up for. People who have longstanding adrenal burnout, as this did, very fatigued, hard time with any energy, brain fog. Those are common symptoms. In addition to that, she had what's called hypogonadism. So you have a gland at the base of the brain called the pituitary gland, which is the command center for many of the hormonal processes in your body, including sexual hormones. In this woman's case, based on the pituitary gland axis that communicates ovaries and uterus, sexual hormones completely out of whack. And this is a woman who's hoping to not had a period years with her opioid therapy. That she also had severe gastritis. Opioids can also tear up your insides, causing your gastrointestinal pain. Lastly, opioids do tear apart your bones, making your bones weak and brittle, causing disease called osteoporosis, which many of you may know. That's a disease. Even lead to spontaneous fractures. At the age of 36, she didn't quite have osteoporosis, but she had already developed what we call osteopenia, which is a weakening of the bones that is the precursor. At the age of 36, osteopenia is it's a young age. She had all these secrets long before she met me, and certainly after meeting me, didn't jump straight into ketamine. She had many attempts, and great credit, so hard, many attempts to wean the opioids on her own, conventional ways, before any of these therapies were ever available. Each time, she was met with severe rebound pain from trying to reduce the opioids, but even worse than the severe rebound was the severe withdrawal, which made trying to reduce it bearable. After a couple of years of various trials, we finally came. The patient finally came to wanted to give IV ketamine. One of the patient Epster, in a part of this woman's plan, she did not. She wanted to have these therapies done. And understandable, who would want to go to a facility to get care would get that care. So that is what we did. In a nutshell, to whittle it down, she got IV treatments at her home, of IV infusions of ketamine, every day for about 6 days. At the end of 6 days, she be off of her own. There were other treatments that we used in addition to ketamine to help get through her withdrawal. What this patient had shared with me, certainly she was going through horrific withdrawal while ketamine infusions. However, though her withdrawal was quite difficult, she had shared was that experience compared to the previous umpteen, which were tenfold, 100-fold worse. The experience that ketamine made that process much easier, much more palatable, and much. And after 6 days, she was off of her opioids, and we were able to address with other adjunct therapies, non-opioid pain therapies, and this patient did quite well. another huge thing. Next case, we have a third case, also an opioid dependent patient. A 60-year-old male with chronic neuropathy and chronic spasticity. Again, that's chronic muscle spasms. And this is due to really spinal disease. This patient had multiple disc herniations at various levels. In addition to the herniation, degenerative spinal stenosis, the hole that runs through spinal column, which the spinal cord runs through, foramen. When that foramen starts to narrow, so that hole starts to narrow, meaning the space that your spinal cord goes through tightens around the spinal cord. As that space tightens and your spinal cord is hinged, result pain and severe neuropathic pain. In addition to that, this patient had spondylolisthesis for a couple of levels. Tough word to say by saying that 10 times fast, but seriously, what a spondylolisthesis is, so you have your spinal column, and that's where spine, one vertebrae slips forward off of the bottom one, and that further narrows that foramen, making it even harder on your spinal cord. So this patient had it at 3 separate. The patient had been opioid dependent for well over a decade. Again, not an uncommon story. Patients 10 years or more. In addition to that, this patient's pain was further exacerbated by underlying autoimmune disease. And as we commonly see, this patient develops anxiety as well as major decrease. So this patient had quite a long, extensive journey of chronic pain, and part of those therapy and really this patient's journey has evolved as these integrative therapies have. So 20 years ago, this patient started off with acupuncture treatments, which was the first thing that got this with surgery altogether, and brought this patient back to some sort of pain. And then some years later, when biopuncture became available, well, before biopuncture became available, this patient would get regular trigger points. Now, again, we talked about trigger point injections. They work well, and if they work well for a patient, then that's great. And certainly don't want to fix something that's not broken. However, as I had mentioned, it's injected into you a combination of lidocaine with steroids. Steroids can bring great benefits to the body, but they do come with downsides. So one of the downsides is that this particular patient, they had gotten so many trigger point injections and so much injectable steroids so that the patient started to muscle atrophy in the area of those trigger points. So patients stop getting trigger point injections and start getting biopuncture and zeal. Prominent to this, the patient wasn't only getting these injections, acupuncture, biopuncture. The patient was also getting electric stimulation, and these therapies were very beneficial. However, with the acupuncture, biopuncture, and electric stimulation, the patient was not able to reduce off of opioids. The acupuncture, biopuncture, and Easton, these were adjunctive therapies in addition to the opioids. So over time, as many patients, opioids don't work nearly as well, but it's required just to get out of bed and out the door so they can function. What really got the patient off of their opioids was legal over-the-counter CBD, and transitioned in actual medical cannabis. And with legal over-the-counter CBD, again, likewise with the multimodality, still getting electric stimulation, radic acupuncture, biopuncture, then we're able to see a significant push. And once the patient then got their legal medical marijuana card, which happened, so medical marijuana went 2016. And this patient was one of the first patients that was started in our practice on legal cannabis. And after a short stint of legal medical cannabis, the patient was 100%. So even off of their opioids, with adjunctive non-opioid pain management, patient then moved on to get shockwave therapy, help with chronic spasm, the chronic persistent spasm that the patient is having. Patient also got ozone therapy. And the ozone therapy certainly helped with the chronic pain, as well as helping with other symptoms, other disease. I mentioned the patient has this underlying autoimmune disease. There are other things in the past medical history, but ozone is able, again, bringing hyperoxygenated blood into really every cell in the body. This patient is much better. And this patient most recently started with IV-CBD to further, again, we talked about how the role of chronic pain. I mean, ultimately, I think for most patients, if you wave a magic wand and make that chronic pain disappear completely, uh, that could make them nothing in the world happier than that. However, it's not always a realistic goal, and pain reduction to tolerable amounts, quality of life. This is a patient that is continuing to seek a complete reduction of the pain, and IV-CBD is therapy that this patient is on and has found it quite beneficial. And this patient has days now, or certain portions of days, but even whole days where there is no pain whatsoever. But like anyone with chronic pain, with degenerative joint disease, degenerative spine, these structural issues still there. Uh, so these are the various therapies to keep that pain at bay. But this patient will tell you that they are certainly a success story for their pain, their improvement of life, improvement of function, um, getting better sleep, anxiety, calm depression, and really just being higher level. So those are the three cases that I have here. At this point in time, we're going to switch gears and Q&A session. If any of you have questions, I would ask that you now enter them into the chat and take a few minutes now to gather any questions that you may have, whether questions had this talk, certainly questions that have come up since. If folks Okay, so first question has come up, and so someone asks, does CBD aggravate AFib? That's a great question. Quick answer is no. CBD does not aggravate AFib. So for folks on this night, AFib or atrial fibrillation is the name of one type of arrhythmia or irregular heartbeat. It's probably the most common type of arrhythmia heartbeat that was. And so when people do have AFib, one of the risks clot causes a stroke. Many people who have AFib are on anticoagulation as well as other cardiac medications to keep their heart rate at a controlled slow rate. So cannabis and CBD do not aggravate make AFib worse at all. In fact, if anything, um, cannabinoids, CBD being one of the cannabinoids, cause what's called it has what's called a vasodilation, meaning your vasculature or your veins dilate, and that's part of how cannabis and CBD bring a medical benefit by improving patient. Um, in that process, CBD actually has a very, I wouldn't call it an anticoagulant, and it's not a, so if you have coronary artery disease, it's not a aspirin. If you have AFib and you're on Eliquis as an example, it's not a Eliquis. However, CBD does have a very mild blood thinning effect and a part of the medical beauty. So if anything, CBD would be beneficial to someone in an anecdotal way. There are no studies, there's no reports or research done, as far as I know, of in the setting of AFib, but just in terms of academically connecting the dots together, that's perfect. Very insightful. Thank you, Dr. Bernie. Thank you very much for that compliment. Oh, now, oh, all right. Next question. How painful is acupuncture? That's a great question. So, of course, anybody that's going to get stuck with a needle, that would be a normal question, normal, possible even fear of pain getting stuck, especially if you see pictures of with acupuncture. One might have many needles stuck. It's not something you're used to seeing and be a little bit alarming. So the acupuncture needles are so thin. Um, So in Western medicine, when we talk about needle size, there's the gauge of the needle that we use. The thinner the needle, the higher the gauge. The thicker the needle, the lower the gauge number. Um, uh, Anytime anybody gets stuck, get their blood drawn or to get an IV line, most patients want the thinnest needle possible or the highest gauge so that it's the least painful. There is no needle in Western medicine that is of a similar gauge as an Eastern acupuncture needle. That's how thin it is. Most people, when they get poked with an acupuncture needle, either report didn't feel anything, especially if that's an area of spasmed muscle or pain. They often don't feel the needle at all. Uh, Ever. Oh, and someone had just chimed in that if the pain is bad, that they don't feel acupuncture at all. Very true. Other people, some sort of a sensation. That sensation oftentimes is described as pressure. It's described as heat. Um, some people do feel a little bit of a little bit of a pinch, but it's really not pain. Now it can happen where we put that needle in and we happen to literally hit a nerve with that as it goes in. And if that does happen, a patient's going to let me know. They're going to go, "Oh, that's really uncomfortable," and that needle is going to come right out. Um, but again, the likelihood of that happening is small. That does happen to a particular patient. The likelihood of that happening again on that same treatment is highly unlikely. But again, those are some of the things I can share about acupuncture. Most people say no, not no pain at all. In fact, once the acupuncture needle is in, oftentimes out of a 20-minute course of acupuncture therapy, once or twice, and I will twirl your needles or twist them. Or if you go to any other acupuncture therapist, you might find that the acupuncturist is actually twirling. That twirling the needles is supposed to stimulate that chi, that life force of energy I was talking about. Most people report is when those needles are twirled, it actually feels very good and even Any other questions? Hey, there are no other questions in the chat. I hope this was a positive session for you all, that you all took a little something home, that you learned something with. And by all means, next time you come in for an appointment, if any of this is pertinent to you, please bring it up, and I will be happy to address any of this with in the everybody. Thank you for joining me this evening, and have a wonderful